Welcome to the Nursing and Healthcare Leadership MSN Specialty Program at Vanderbilt University. My name is Rick Waters and I'm the Interim Director of the program. As part of the activities to celebrate our redesign and launch of our Nursing and Healthcare Leadership Program in August of this year, we plan on scheduling 3 short videotaped interviews with faculty who have been instrumental in the development of the program, specifically that redesign. And our focus is really, it's the art and science of leadership. And that's the reason why we decided to move forward with the redesign of the program. The purpose of the interviews are to talk to some of our faculty and raise a couple of the questions or commonly raised questions by students with respect to Vanderbilt University and the School of Nursing. And I'm pleased that Dr. Debra Arnow is our guest for this interview. And Dr. Arnow is an associate professor in the School of Nursing. Welcome. Thank you for taking your time to be a part of this.
Glad to be here.
Thank you. One of the questions that we often get from potential applicants, and I know you are in the clinical setting as well, and you get this type of questions, one of the questions that often does arise is, we have potential students saying that they're interested in a leadership position, and they really think they're ready. They're ready now for a leadership position. But they do ask, why is it necessary? Why should I think about taking an MSN degree program in healthcare leadership? And I'd be interested in your thoughts in terms of why that would be important.
Well, for any nurse who has chosen to take the path of a leader, it's a specialty. And I think we need to recognize it as it's a specialty that you devote the time and commit to learning and becoming an expert in all of the courses that we offer here. It's the basis for the competencies to be a nurse leader. And whether it's finance or quality or human resources, strategic planning, these are all real, it's really you're devoting yourself to these particular specialties and you're going to be the expert and people will expect you to be the expert.
Thank you. And one of the other things is, and I'll just mention to our audience, that one of the other things is, in this redesign over a period of 1 year, we had our faculty, as I mentioned, involved in the process, but we also had healthcare leaders in the community involved, as well as former graduate students. And one of the things we talked about in that redesign was the uniqueness in terms of our program. How is it unique? And as we all know, potential students are well versed in terms of what MSN programs are available across the country. And I'd be interested for you to speak about the uniqueness. Why would I be attracted, let's say, to Vanderbilt University School of Nursing program as opposed to other programs? And I'm thinking of that uniqueness, and you can speak to other specific courses, or you could speak to the actual redesign program itself.
One of the things that strikes me about our program here is the faculty are totally devoted to the success of the students. And there is an unlimited amount of time that I've seen faculty devote to the student so that they really are successful in the courses. And there is, there isn't anyone who isn't able to get through with that kind of support. And it's the enthusiasm that the faculty has with the students that it just sort of, they absorb it. And I think they feel very excited about being here as well. When we have graduation or when we have our classes together and they come together again as a class, they are excited to be with each other, they network, they learn about what others are doing in other parts of the country, and it's almost like a reunion whenever we are together. And of course the faculty get to know them personally and professionally, and we actually depend on them in the future. We may need that particular expert in a field to help us with our courses and with future students.
Well, thank you very much. And the other part, just to let you know, in terms of Dr. Arnow, she also teaches in our DNP Executive Leadership track. And one of the things I wanted to share with you is that the faculty that were involved in the redesign of the program, including Dr. Arnow, is also on the faculty for the executive leadership in our DNP program as well. And when we talk about an immersion experience, for example, the students are going to spend 2 to 3 days on site in a semester. Part of it actually comes from the idea of the engagement and really, as you said, in terms of working with the students and developing that relationship with the students as well. The other comment I just want to make is in this relaunch of the Nursing and Healthcare Leadership Program, we also have a relaunch of our Nursing Informatics program as well. And the first semester, our healthcare leadership students and our nursing informatics students will actually be taking the same courses together. That opportunity to develop those relationships, and we know how much nursing informatics is so much a part of our role and the need that we have in terms of healthcare and the nurse leader being responsible for that. So we're very excited about that link between those two components and two programs. And again, I just want to say, Dr. Arnow, thank you very much for coming and participating in the interview and sharing your thoughts and ideas with respect to the program.
Thank you.
Thank you very much. Thank you.